All right, Amanda, thanks. Right now, it's not clear how this declaration would translate to real change for the average Mainer. A spokesperson for the Maine Department of Health and Human Services responded to the president's plan in a statement saying, in part, the department agrees this is an epidemic. This is why it is important to dedicate available resources on proven, evidence-based treatment options that will provide the best results for an individual. Attorney General Janet Mills says she told the president that Maine needed help fighting the opioid epidemic, and she hopes this will give our state the resources it needs.
It is an emergency, it's an epidemic, but we don't need any declaration of emergency. It simply is an urgent situation. I told the president this myself back in February. I met with him at the White House along with Republican and Democratic attorneys general from across the country. And I asked him for greater resources for prevention, treatment, and education. Nothing's come of that. Nothing's happened. I hope he's listened to the message. I hope he's heard the message now. I hope he'll turn around and make sure that all states, including Maine, get enough resources to address this epidemic.
The last national emergency was declared by President Obama in 2009 in response to the H1N1 outbreak. With thousands of Americans coming down with the swine flu, hospitals were overloaded and needed more resources and funds. When President Obama declared it a national emergency, it allowed his Health and Human Services Secretary to make decisions and see results faster. It's not clear right now if this national emergency would have a similar effect, but we can use this previous situation as a benchmark.